Afternoon, Melanie. How are you? Are you okay?
Hey,
you all ready for your operation?
Yeah.
Okay, right. We've got a couple of things. I'm going to go through the operation with you again, just so you're aware of what's going to happen. I'll do a quick examination, and I need to mark your leg, and then ask you to sign your consent form. Okay. Is that okay?
That's fine.
Right, okay. So, we're going to do an arthroscopy of your knee, as we spoke about in clinic. So I'm going to make two little holes on the side of your kneecap, one there and one there. I'm going to look inside with a camera. We're going to find out where this shock absorber or meniscus is torn. I'm going to sort that out for you.
Okay.
And then I'm going to look around the whole of the rest of your knee, make sure there's nothing else going on that we hadn't picked up in clinic. And if there is, I'll sort that out for you at the same time. Okay. Is that okay?
That's brilliant.
You're going to have two little stitches, one there and one there in your knee afterwards. And they're going to stay in for about 10 to 12 days. Okay. I'm going to put a woolen bandage over your knee from your mid-thigh to mid-calf, and you'll keep that on for a couple of days. So you'll have the operation this afternoon, you'll be able to go home this evening, keep that on for a couple of days, and you shouldn't drive during those couple of days. Okay. And then you can take it off yourself when you're at home. Is that okay?
That's perfect.
Okay, so let's have a look at your knee. If you put it down straight for me, that's great. You can over straighten it, that's fine. And then you can bend this knee up and you get to a good 130 degrees, that's fine. Come down halfway. So you were sore down here. Are you still just sore there?
Yeah.
Okay, that's great. And nothing down the front here?
No.
And nothing on the outside?
No.
That's excellent, okay. If you put that knee just straight and then bend it over mine, that's fantastic. And bend it down on the bed, that's fantastic. Just make sure that ligament's intact, that's good, and that one's intact, that's great. I'm just going to see whether this one's fine. That looks good. If you come up to there, that's excellent. That's right, and then down straight, almost finished now, and you've got no swelling in the knee, and that's good as well. Excellent. To cover you up.
Thank you.
Right, we just need you to sign your consent form.
Yep.
So can you just confirm that you're Melanie Wood?
Yep.
And that's your date of birth. And we're doing a right knee arthroscopy, which means looking inside the right knee. And meniscal debridement, so cleaning up of the shock absorbing cartilage on the inside of your knee. The benefits are to improve the pain in your knee. And the small risk, and they're very small, there's a very small chance of getting a wound infection that may require some antibiotics. There's a very small chance of a little bit of bleeding. In itself, if that's not a problem, but it may cause a little bit of bruising on your knee, which will be present for a week or so afterwards, and also maybe a little bit of swelling, again, just for a week or so afterwards. But you won't require a blood transfusion or anything like that. I've signed it down here and dated it, and the telephone number of the secretary's down there, and you get a copy of this to keep. So that's your copy, which you can keep. Okay. And if you're happy to go ahead, if you can just sign down there. And finally, I just need to put a mark on your leg, okay? So we're doing a right knee arthroscopy. So put a mark on your leg. Great. Right, I'll see you down there later on. Any questions, anything else? Okay, good. You'll be fine, okay?
Thanks a lot.
Bye-bye.
Bye-bye.